Good morning, everybody. This is Dr. Fernandez. It's Saturday, July 14, and happy Saturday, and I hope you all are having a wonderful day. It's going to be a nice, wonderful weekend here in Burbank, and I am here to talk to you guys about being open. What do I mean by that? Being open, I mean being open with other forms of health treatments like chiropractic. Okay, the reason why I'm saying that is because I had this patient this last Wednesday. She's 34. She presented here in the clinic with moderate to severe headaches. Um, and let me tell you her background. Her headache started since she was in high school. Her parents would just bring her to her insurance medical doctor, and that doctor will just give her drugs, migraine medication in particular. I don't know if it's Imitrex, but something for migraines. She went to college. She went to CSUN. She did all her college stuff and sports, and she considered chiropractic, but her friends and herself, they just went to the student clinic, and the nurse gave her medication again for her headaches, for her migraine and tension headaches. But again, it's still moderate to severe headaches. Um, and she's 34 now. Same things. That's all she's been doing is drugs, medication. And last week, Monday, Tuesday, and Wednesday, she said her headaches are so severe she didn't even go to work. Um, so Wednesday, she finally decided, I'm gonna try something else besides medication. So she went online. She found us on Yelp under Chiropractic in Burbank, and she called us, and she came in here 3 o'clock in the afternoon. When I saw her, she was like she had this veil of dullness or achiness, and like there's like a pressure right behind her head, right behind her neck. She was walking, so she looked like she's defeated. She looks so down. She looks so weak. She's only 34 years old. um, so she told me all this stuff, of course, and then I told her what I do as a chiropractor. And some of you guys have heard this before. I told her, as a chiropractor, I deal with the spine. The spine is the connection between your brain and your body. So that connection should be clear. Okay? Sometimes that connection becomes out of place. Those bones on your neck, on your spine becomes out of place, crooked and misaligned. And when that happens, the nerves on your neck gets pinched, causing you all sorts of pain and problems on your neck. When your bones become out of place there, it will pinch the nerves there, causing you headaches. Why? Because those nerves travel to your head, so it will cause you headaches. So she thought about something. You know what, doc? I remember in high school, she used to pole vault, that big long stick, and then you run, and then they jump over something. She used to pole vault, and at one time she told me that, I remember landing differently, and it felt very different because I landed on my head and I landed on my neck, and I'm not supposed to do that. And it was, she knew that she landed differently, but she was a teenager, and she just shook it off. But she's told me that ever since then, I think that's when my headache started. Okay, so let's check your neck. It could have been a bone out of place. Remember, drugs, you can take all the drugs that you want, but if that drug, that drug, if you take it, that drug does not go down and go up and fix that bone there. It does not. Those drugs just mask the pain. So I checked her neck. Sure enough, we have 7 bones in her neck. 1, 2, 3. Her 3 most upper cervical 1, 2, and 3, were out of place. I checked it. I saw the problem. I adjusted her neck, and while she was laying down there, I was like, "You okay?" She started bawling. She started crying. It's like, "What's wrong? Was that a hard adjustment? I'm so sorry." I suddenly apologized. "I'm so sorry. That was hard. Too hard for you. I know it's your first." She said, "No, doc, that wasn't it." "Well, what's wrong?" She told me, "Well, I have never felt like this before. The minute you adjusted my neck, I slowly felt my headaches go away. And remember, she walked in here with severe headaches. And the moment that I adjusted her neck, and I cleared that bone pinching the nerve, she said she felt her headache just slowly diminished. And she was so happy. She started crying. It's like all I could do was like give her here's a Kleenex. Oh my goodness. I felt so bad, but I knew she was happy. I knew that I helped her. And she knew in the inside that she found her relief. She found her answer, which was chiropractic. After 34 years of suffering, can you believe that? 34 years. That's all it took, So, yesterday, she came in here like a different person. She was like a cheerleader. She was standing upright, big smile on her face. She looked so bright. She looked like a winner. She told me, Doc, I didn't have a headache Wednesday night. I did not have a headache Thursday. I did not have a headache today, which was Friday. I did not even take any headache medication. No headaches for the last 3 days. So she told me, I am a true believer. No more medication for me. No more headache medication. So that's what, I adjusted her. And she told me, Doc, I'm going to enjoy my weekend because I'm going to go to San Diego. So I guess she's in San Diego now. It's Saturday. So she was so happy, So for me, my message really is for all of you guys, be open. If you know anybody who are having headaches, who are having neck pain, who are having back pain, okay, be open to other forms of health treatments. Okay, for me, this is what I always say. This is my coffee this morning. Let's see, where's the camera? Chiropractic first, drug second, surgery last. Okay, that's what I always say. Get adjusted. Get adjusted. If you're not near me here in Burbank, get adjusted somewhere else. Okay, stop suffering. All right, medications, it doesn't do anything. Your headaches are not because of a deficiency in Advil, okay, or a deficiency in Tylenol. Most of us, we have problems with our spine, and it needs to be adjusted. All right. So that's it. Be open, please. Be open. Tell your friends, tell your family about chiropractic care. And we love you. We miss you. We'll see you here soon. Okay. You take care and God bless. Have a wonderful weekend. Bye.